This medication is used to relieve moderate to severe pain caused by spasms in the urinary tract. It contains two medications, belladonna and opium. Belladonna works to reduce the spasms, while opium is an opioid medication that helps to alleviate the pain. It is important to note that this product is not suitable for use in children 12 years or younger. The recommended dosage and best time to take this medication should be determined by consulting with a healthcare professional. Before using Belladonna Alkaloids-Opium 16.2 mg to 60 mg Rectal Suppository, make sure to read the medication guide provided by your pharmacist. It's important to wash your hands before and after using the suppository, and to follow the instructions for inserting it into the rectum. After inserting the suppository, lie down on your left side with your right knee bent. Try to avoid having a bowel movement for an hour or longer so the drug can be absorbed properly. If you experience nausea, talk to your doctor or pharmacist about ways to decrease it. The dosage of this medication is based on your medical condition and response to treatment, so it's important not to increase the dose or use the medication more often than prescribed. Pain medications work best if used when the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. If you suddenly stop using this medication, you may experience withdrawal symptoms. Your doctor may need to lower your dose slowly to help prevent withdrawal. It's important to note that this medication may cause addiction, especially if you have a history of substance use disorder. Use the medication exactly as prescribed to lower the risk of addiction, and talk to your doctor if the medication stops working well or if your pain lasts or gets worse. Some common side effects of Belladonna Alkaloids-Opium 16.2 mg to 60 mg Rectal Suppository may include nausea, vomiting, constipation, blurred vision, lightheadedness, dizziness, drowsiness, increased/decreased sweating, or dry mouth. If you experience any of these effects, it's important to let your doctor or pharmacist know. To help with dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. To prevent constipation, it's recommended to eat dietary fiber, drink enough water, and exercise, and you may also need to take a laxative. Your pharmacist can advise you on the right type of laxative for your needs. To reduce the risk of dizziness and lightheadedness, it's best to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, it's crucial to contact your doctor right away if you experience any serious side effects, such as mental/mood changes, difficulty urinating, fainting, slow/fast heartbeat, eye pain, vision changes, or signs of your adrenal glands not working well. If you experience very serious side effects, such as severe stomach/abdominal pain, seizures, slow/shallow breathing, severe drowsiness/difficulty waking up, or signs of a serious allergic reaction, it's important to seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist for advice. Opium/belladonna has the potential for abuse and addiction, which can lead to overdose and death. It may also cause severe, possibly fatal, breathing problems. To lower your risk, your doctor should prescribe the smallest effective dose for the shortest possible time. It's important to ask your doctor or pharmacist if you should have naloxone available to treat opioid overdose. Make sure your family or household members are aware of the signs of an opioid overdose and how to treat it. The risk for severe breathing problems is higher when you start this product and after a dose increase, or if you use the wrong dose/strength. Using this product with alcohol or other drugs that can cause drowsiness or breathing problems may cause very serious side effects, including death. Be sure you know how to use this product and what other drugs you should avoid taking with it. Get medical help right away if any serious side effects occur, such as slow/shallow breathing, unusual lightheadedness, severe drowsiness/dizziness, or difficulty waking up. Keep this medicine in a safe place to prevent theft, misuse, or abuse. If someone accidentally uses or swallows this drug, get medical help right away. Before using this product, women of childbearing age should talk with their doctors about the risks and benefits. Tell your doctor if you are pregnant or if you plan to become pregnant. During pregnancy, this medication should be used only when clearly needed. It may slightly increase the risk of birth defects if used during the first 2 months of pregnancy. Also, using it for a long time or in high doses near the expected delivery date may harm the unborn baby. To lessen the risk, use the smallest effective dose for the shortest possible time. Babies born to mothers who use this drug for a long time may develop severe, possibly fatal, withdrawal symptoms. Tell the doctor right away if you notice any symptoms in your newborn baby such as crying that doesn't stop, slow/shallow breathing, irritability, shaking, vomiting, diarrhea, poor feeding, or difficulty gaining weight. Before using this medication, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any medical history of kidney disease, liver disease, brain disorders, breathing problems, spinal problems, difficulty urinating, substance use disorder, heart problems, gallbladder disease, pancreas disease, adrenal gland problems, mental/mood disorders, stomach/intestinal problems, glaucoma, or muscle/nerve disease. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol and marijuana while taking this medication, as they can make these side effects worse. It's also important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you know how this medication affects you. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication may make you sweat less, which can increase your risk of heat stroke. It's important to avoid activities that may cause you to overheat, such as hard work or exercise in hot weather, and to drink plenty of fluids and dress lightly when the weather is hot. If you are an older adult, you may be more sensitive to the effects of this drug, especially slow/shallow breathing and drowsiness. If you are pregnant, this medication should only be used when clearly needed, as it may harm an unborn baby. It is also unknown if belladonna passes into breast milk, while opium does pass into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could impact how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with Belladonna Alkaloids-Opium 16.2 mg to 60 mg Rectal Suppository are certain pain medications, cimetidine, naltrexone, potassium tablets/capsules, pramlintide, rifampin, and samidorphan. There is an increased risk of serious side effects, such as slow/shallow breathing and severe drowsiness/dizziness, if this medication is taken with other products that may also cause drowsiness or breathing problems. It's important to inform your doctor or pharmacist if you are taking other products such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you use this drug. And don't forget to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's always best to ask your pharmacist about using those products safely. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, administer naloxone if it is available, and then call 911. If the person is awake and not showing any symptoms, contact a poison control center immediately. In the U.S., you can call 1-800-222-1222 for your local poison control center, and in Canada, residents can call a provincial poison control center. Overdose symptoms may include severe drowsiness, slow or shallow breathing, severe dizziness, fast heartbeat, or even coma. Always seek medical help if you suspect an overdose. Remember, this medication should be used as directed by your healthcare provider, and it is important to follow the recommended dosage and timing for optimal results. It is important not to share this medication with others as it is against the law. This medication has been prescribed specifically for your current condition and should not be used for any other condition unless directed by your doctor. If you require medication for a different condition, a different medication may be necessary. If you are using this medication regularly and miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. If you are taking Belladonna Alkaloids-Opium 16.2 mg to 60 mg rectal suppository regularly, and you happen to miss a dose, simply take it as soon as you remember. However, if it's almost time for your next dose, it's better to just skip the missed dose and take your next scheduled dose as usual. It's important not to take a double dose to make up for the missed one. Stick to your regular dosing schedule. It's important to store this medication at room temperature, away from light and moisture. Do not refrigerate or store in the bathroom, and be sure to keep it out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the medication when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.